I'm Ed Eckart. I'm the Assistant Director of Public Safety. In working with the Department of Health, along with our pre-hospital care medical director, there's been a specific protocol and general order that's been drafted for police, fire, and EMS personnel. That general order talks about how to, first of all, let me start with the initial process of a 911 call. Actually, we've implemented a surveillance tracking tool that will be attached to every 911 call that comes in to the EMS Communications Center. If patients meet certain criteria of illnesses or symptoms of illnesses, they'll be asked some special questions that help us track and determine if somebody may have either been exposed or may have the symptoms that would indicate that they are actually contaminated. When people call the 911 center, if they meet these certain criteria, it's important, though, to report that this won't slow down the dispatch of the ambulance. The ambulance will be dispatched prior to the additional questions being asked. If they meet the criteria, that information will then be sent out to all of the initial responders, whether it's police, fire, EMS that's going to that address, so that they are aware and they can be prepared. Additionally, that information then will be passed on to the Department of Health, the state ODH, as well as the CDC in terms of being able to track it after the fact. Within that protocol that's been established, there are very specific guidelines for the first responders in the event that a patient meets that criteria. Basically, what we're talking about is personal protective equipment, and anybody that's in the healthcare industry understands that universal precautions as it relates to infectious disease and infectious disease preparedness is really the bottom line issue here for our responders. So on the front end, through the 911 system, we started doing that this morning, and we will continue to do that. In the event that our first responders do encounter a patient that meets the symptoms and meets the criteria for a potential contamination, our EMS commissioner and medical director, along with the director of the Department of Health, have been in contact with all the area hospitals. We have a good understanding of the area hospitals' capability to manage patients that have Ebola and other infectious diseases. Fortunately, we do have a lot of experience with this type of infectious disease situation with flu, H1N1, and things that have been out in the past. So we're very comfortable with our relationships with the hospitals, as well as our first responders' ability to know what to do in terms of self-protection. We are continuing, though, to monitor not only specific calls, but also that infectious disease tracking tool that we've implemented will also allow us to target, or not target, but identify areas or neighborhoods in the city where we may be seeing certain changes in symptomology. We can compare that to our past historical CAD data, and that information will be shared with the Health Department, the Ohio Department of Health, as well as the CDC, as we gather that information as well. So I think from a first responder perspective, we're in good shape. Our personnel are very well trained and capable to manage this, and we have very good relationships with the hospital systems in the city that will help us manage it as well.